Hi, it's Henry Shelford here for Chairperson of SarcoidosisUK, providing an update video on COVID-19 and sarcoidosis. We've obviously all seen the latest advice from the government coming out last night, and further information today, and I think that is what we've all been looking at. Now, the government has said that specifically talks about people who are vulnerable, and those specifically include people who would normally have a flu, to be given a flu jab, and specifically people on steroids. So very clearly people with sarcoidosis fall into that category, as we expected. And the advice is that, the advice has been for social distance, but the strongest version of it. It hasn't gone quite so far as to say everyone should self-isolate. And in social distance, it's any member of a vulnerable group. Social mixing in the community, strongly advised against. Having friends and family to the house, strongly advised against. Using remote access to NHS and essential services, strongly advised. Vary daily commutes, use less public transport, strongly advised. Home working, strongly advised. Essentially it is, well, social. It's not quite social isolation. Puts us in a tricky spot as a charity, because social isolation is clearly the safest option, and it's also clear that the advice is changing on a very quick basis, almost daily, and we're also seeing and we're seeing the reason the government doesn't want to recommend self-isolation is because it worries that people won't stick it out, and which is an interpretation on behaviour, and is part of their behavioural science policy. I think from our perspective, it's clearly the safest option is clearly to self-isolate and stick it, and so that is our recommendation. And we want to be very clear. So as we see the advice, and particularly what we're saying is, over these next few days, as we're getting clarity that we don't quite have yet, we know that we're being told the virus is entering into its fast stage. We know particularly London is ahead of the rest of the country. It's something we're in London, so we not wish to be ahead on. That whilst we wait for that clarity, I think recommending self-isolation is probably the best approach, but you have to stick at it. And then let's see as we get that clarity. And what does self-isolation mean? It does mean self-isolating. So if you are in a household, it means you're not having people come in and out. It means if you're sharing that household with someone else, they can't be going out, they need to be home working. You have to isolate as a household together. And if you can't do that, you need to, which is where the government advice is, it's really doing pragmatic social distancing, so it's not social mixing. It's being careful with your commute. It's being careful about how you're mixing with people. So the advice from the charity is that we think that self-isolating is the right thing to do, and it's certainly the advice we're giving out now. It's clear that the government will be advising people do that in upcoming periods. I think whilst it's still not clear, and the advice is, we're getting clarity on the advice, it is clearly the safest option, but it is going to be difficult, and you have to stick at it. The big risk is that we don't. We are getting a lot of advice, questions on medication, and I wanted to clarify that on that. I need to refer to, you obviously need, if you can, to talk to your own clinician. We cannot give medical advice, but in our previous videos, Dr. Rubina Coker was clear. You are on medication for a reason, and you should keep on it. It's also very important not to just stop, as the majority of sarcoidosis medication can be dangerous if suddenly stopped. The videos are still are obviously up. Do go back and look at them with Dr. Rubina Coker. She's very, very clear on this. We have created a letter for people with sarcoidosis. We'd hope to get that up on Friday. It has to obviously go through various edits and be seen by our clinicians. As you can imagine, they're very busy. We've not gone through all the edits we want. So what we have done is we've put it live, but we know that the main information is right. It's whether or not we're going to put more in it, but what's there is right. So we've published it as a draft, so it's there for you to carry should you get COVID-19. We advise you have it and give it to the clinician that treats you. The main focus is that we know that a lot of people with sarcoidosis, up to 50%, have cardiac involvement. We know that that's previously not been understood, so many people have never had their hearts investigated, and those that have had it has been some time ago. So we're recommending that you, when you go in, it's quite one of the things that is relatively standard is that people are going through an MRI, and what we're saying is that when that MRI is happening, that the heart is looked at as well. And in doing so, that means that if there are any underlying issues, they can be looked after. We think that will obviously reduce the mortality rate, particularly for people with sarcoidosis, which is obviously our absolute critical aim. The charity's here for you. We will keep you up to date. Follow us on our social media, sign up for the newsletter, and we'll be sending out information. Our next steps, we talked about the political pressure we're trying to put on so that underlying conditions have a treatment plan. We are pushing forward, asking for that. We also want to see a system of information sharing, so as people are getting treated and as clinicians learn, they can share so that each condition gets updated so that we can become better at treating over time. This is going to save lives, and it will also save the NHS. So what we want to do is have trigger alerts. So for instance, someone with sarcoidosis comes in, the trigger alert says you need to investigate their heart. And for other diseases, other things will be pragmatic. It'll also save the NHS money because by not triggering these things, the NHS is now not treating those more complex things. They're not treating those secondary issues that are being caused because they were able to nip them in the bud and stop them having the impact they could have had. And so those two things are very important. So we're looking for the government to put together, work with clinicians, particularly in this preparatory period, treatment plans so that medics who are stretched, who are working perhaps in not their area of expertise, but are there doing the best they can, they have crib notes to know that when someone comes with certain conditions, that they need to also check these things. We're working on that. We will see updates on that very soon. I also have some other updates for you. So our badges, I've got one here, which is this is the little one, which is earlier on, but it's and these are our real ones. So these are the ones that we're sending out. They're just over 50 centimeters, so can easily be read from a distance, which is our aim. They have my cough is not contagious. It's sarcoidosis, not coronavirus. My cough is not contagious. It's an underlying lung condition. And I have an underlying condition, please take extra care around me. So they've already sold out, we sold out our initial batch, we're nearly sold out on batch 2, which arrived about half an hour ago, and we've ordered another batch. So we have plenty. They're £2.45 for 2 with free shipping. We can also ship across the world. If you can't afford them, please call us and we will send them to you. We have support groups up and down the country. For obvious reasons, they're now going virtual. To our support group leaders, we'll be sending you an email shortly with how to do that. We've got a system in place that enables you to have a virtual support group with video as well as a dial-in number. So people who aren't familiar or comfortable with or have the equipment to do a video link up, then they can use their phone instead. And we think it's really important that we have both those facilities. And I just want to say, look, this is a scary time for all of us. And I wanted to remind us in the midst of the fear to look to the light. And by that I mean, whenever you see the challenges, look to all those that rush to help. Look at the NHS workers going in despite the risk to their own health. The neighbours, friends and families helping each other out. And the warehouse and supermarket staff doing their best to keep shelves stacked. The media going out to keep us informed. And the scientists and politicians trying their best. And everyone trying to do their bit. Whenever you see something happen, you see people rushing in to help. And I think focusing on the people who are rushing in to help is a good thing right now. This is a new situation. The course is not set. And we must expect wiggles in the road. And we must all try hard to play a positive part. And I think the most important thing right now is to be kind and to look after each other. Now, we as a charity are here trying to look after, to do our bit. Talking of which, I do need to give a shout out for donating to the charity. This is a very challenging time for us, as it will be for almost every charity. Most fundraising events have been cancelled. This is the big fundraising time, lots of events. And that money is normally the money that carries us through the year. It allows us to fund the research towards a cure, to provide support, the information to build awareness. So if you can, please consider donating. And if you can, please consider a monthly direct debit just to cover us over this period. And there is a link directly on the website. That's it for now. We will obviously update you as new information comes in and as we work towards it. Please consider donating. Otherwise, stay safe, self-isolate, be kind, and allow people to be kind. Allow people to be kind to you. Thank you very much for your support. Thank you for watching, and we look forward to updating you. And stay safe.